Now we have the spleen-6, which is located through 3 proximal to the highest prominence of the medial malleolus on the posterior border of the medial crest of the tibia. Sa point explanation, the most important point on the meridian, it is the area distal point for the lower abdomen, used in all problems of the urinary system and the reproductive system. It is the meeting point of the 3 yin meridians of the foot and is used to tonify the general yin in the lower body. Next, we have the spleen-7, which is located 6 proximal to the highest prominence of the medial malleolus on the posterior border of the medial crest of the tibia. Point explanation, an analgesia point for the perineum, used in painless childbirth with acupuncture, together with the point spleen-6. Both points are used in one leg with electrostimulation when the patient begins to feel pain in the perineum. And then dispersed frequency is used so that the patient does not get used to the stimulation. Next point, we have the spleen-8, which is located at 3 distal to the junction of the shaft and the medial condyle of the tibia. Spleen-9, at the posterior border of the medial crest of the tibia. Point explanation, we have the C-cleft point on the meridian and a symptomatic point for the dysmenorrhea. It is also effective in premenstrual breast distension. Next point, we have the spleen-9, which is located in a depression distal to the medial condyle of the tibia, at the junction of the shaft and the medial condyle. Point explanation, also called the LASIK point. It is used to eliminate excess fluid and works well in all cases in which the kidney function is normal. The effect is very quick and the patient cannot wait to get to the toilet once the needles come off. The location of points spleen-6 to 9 is described as behind the tibia in most books, and this is absolutely correct. Let the liver meridian and kidney meridian have the same description of pathways. Therefore, we have to differentiate these three as much as possible. If not, we will be creating a new symptoms instead of curing the old ones. The liver meridian is the most anterior and flows almost at the posterior edge of the tibia. The spleen meridian is in a good hole behind the tibia, and the kidney meridian should always be directly in a line above the kidney tree, which is in the middle between the prominence of the medial malleolus and the Achilles tendon. Next point is spleen-10, which is located with the knee flex. Spleen-10 is located 2 proximal and slightly medial to the medial superior border of the patella, in a depression on the vastus medialis muscle. Point explanation, a symptomatic point for allergy and pruritus. It is a point used to clear blood heat and clean and purify the blood. Hence, it is also good against skin infection, acne, eczema, etc. Next point, we have the spleen-15, which is located 4 lateral to the center of the umbilicus. Point explanation, not a commonly used point, but good against ascariasis. Next point is spleen-21, which is located on the mid-axillary line in the 6th intercostal space. Note, according to some texts, this point is located in the 7th intercostal space. Point explanation, the major lu connecting point of the spleen. The lu point of the yin meridian can tonify its yin and reduce the yang. So it is the best point in hyperactive yang state. However, the spleen channel has two loop points and two connection to its coupled organ, stomach. Spleen 21 is used in cases of hyperactive yang in the stomach or esophagus, such as hyperacidity and acid reflux, worse when hungry and better after bland food. It is also the last point and exit point of the meridian before it connects to heart 1.